You will first put on gloves and then remove the current tubing from the end cap on the short extension IV tubing, and then clean the connector with an antimicrobial wipe. Allow it to dry and then remove the cap from the new administration set and insert it into the end cap. You will then loop the administration set tubing near the entry site and anchor it with tape so that it doesn't move. Then you will open the clamp on the extension tubing and open the clamp on the administration set as well. Check the drip chamber, verify that the flow rate is correct, and turn on the device. Then you will apply the disinfectant caps to each access site on the administration set and check the tubing for any kinks or any air bubbles, as well as check the IV site for any infiltration or signs of something going wrong. When you're monitoring an IV that is being given with the use of an electronic fusion device, it's important to check the infusion rate and to note the position of the fluid in the IV container in relation to the time tape. It's also important to teach the patient about any features on the electronic device, such as any alarms or indicator lights, and to instruct them to call for assistance if they experience any pain or discomfort, if they notice that the bag is almost empty, or if any alarm is sounding. If an IV is being infused via gravity, it's important to check the drip chamber and to time the drops. It's also important to check the tubing for anything that might interfere with the flow, such as kinks or bubbles, and to make sure that the clamps are open in all positions. It's also important to observe the dressing for any leakage of IV solution, any bleeding, to inspect the IV site itself for any indication of infiltration, phlebitis, infection, bleeding, and to ask the patient if he or she is experiencing any discomfort or pain. If any symptoms of discomfort or pain are present, the IV should be removed and restarted somewhere else in the body. One complication that can occur is infiltration. This occurs when the catheter becomes dislodged from the vein and the IV solution is flowing into the subcutaneous tissue. Infiltration usually presents with pallor, coolness, and edema in the arm, as well as leakage around the site. Before changing the dressing on an IV, you will perform hand hygiene and put on gloves. You'll put a disposable pad underneath the arm with the IV access, and you will push pause on the pump if a solution is currently infusing. You will then hold the catheter with your non-dominant hand, and starting at the device hub, you will gently pull the dressing toward the insertion site and carefully remove the old dressing, making sure to not accidentally dislodge the catheter. You'll observe the site for any presence of phlebitis or infection or infiltration, and then if any are noted, you will relocate the IV. The next step is to cleanse the area where the new dressing is going to go. You're going to cleanse it with an antiseptic solution such as chlorhexidine in a back and forth motion for at least 30 seconds and allow it to dry. You will then apply a skin protectant to the same area and allow it to dry as well. Then you will place the new sterile dressing over the venipuncture site, being sure to fully cover the catheter before pressing around the rest of the site. Then you will label the dressing with the date and the time of the change and your initials, and then loop the catheter tubing and tape it into place near the entry site. You will then turn on the fluid infusion and check that the flow is right and the system is patent. And it's also important to apply an IV stabilization device if one is not already in place. When a continuous IV is no longer needed, the primary line can be capped and then converted into an intermittent infusion device. If using an electronic device to infuse, you will first stop the device and close the roller clamp on the administration set. You will put on gloves and then close the clamp on the short extension tubing that's connected to the catheter in the patient's arm. You will then remove the administration set tubing from the end cap and clean the end cap with an antimicrobial swab and allow it to dry. Next, you will insert a saline flush into the end cap and pull back to make sure that you aspirate the catheter first and check for positive blood return. If positive blood return is seen, you will then instill the solution for over 1 minute or per facility guidelines. Then you remove the syringe and reclamp the extension tubing. And if needed, you will loop the extension tubing and tape it into place near the entry site. After that, you will clean the end cap on the extension tubing with an antimicrobial swab and attach a passive disinfectant cap to the end cap. Before administering a blood transfusion, it is important to ask the patient about any previous blood transfusions that they may have experienced and any complications that may have occurred. The first step in administering a blood transfusion is to prime the blood administration set with normal saline. You will put on gloves and initiate peripheral venous access if it is not already in place. Connect the administration set to the venous access device through the extension tubing and infuse normal saline per the facility's policy. In the hospital setting, 2 registered nurses should compare and validate the following information while they are in the presence of the patient with medical record and the patient's ID band and label of the blood product. The things that need to be validated are the medical order for the blood transfusion, the informed consent from the patient's ID number, the patient's name, blood group and type, the expiration date, and the inspection of the blood product for any clots, gas bubbles, or clumping. The next step is to obtain a set of baseline vital signs before starting the transfusion. And if using an electronic infusion device, you would want to put the device on pause and close the clamp closest to the drip chamber on the saline side of the administration set. You will also close the roller clamp on the administration set below the infusion device. Next, you will close the roller clamp closest to the drip chamber on the blood product side of the administration set and remove the protective cap from the access port on the blood container. You will then remove the cap from the access spike on the administration set, and using a pushing and twisting motion, you will insert the spike into the access port on the blood container. You will want to make sure that you're not contaminating the spike or the access area whenever you're doing this. You will then hang the blood container on the IV pole and open the roller clamp on the blood side of the administration set and squeeze the drip chamber until the inline filter is saturated. You will then open the clamp on the administration set below the infusion device and set the flow rate to begin the administration. You'll start the administration slowly and make sure to stay with the patient for at least 5 to 15 minutes after the administration is started. You'll observe the patient for any adverse reactions such as itching, rash, flushing, or dyspnea. And then after 15 minutes, you want to reassess the vital signs and compare them to your baseline vital signs. After the initial observation, you will then increase the flow rate and calculate the rate to finish the infusion, and this should be no more than 4 hours. When the transfusion is finished, you will then close the clamp on the blood side of the administration set and then open the clamp on the normal saline side to allow the normal saline to be infused. You will then obtain the patient's vital signs and cap the access site, or you will resume the previous IV solution. Ongoing monitoring is very important throughout the duration of a blood transfusion so that any adverse reactions can be caught early. And if there are adverse reactions, the blood transfusion will obviously be stopped. The blood tubing should then be replaced with a new administration set that is primed with normal saline, and this should be infused at an open rate, which is usually about 40 milliliters per hour. It's also important to obtain vital signs and notify the provider as well as the blood bank of the problem that has occurred.